The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to Dr. Hotze's Wellness Revolution. And I believe that you need to have a physician and a staff of professionals who can coach you on the path of health and wellness naturally, so as you mature, you enjoy a better quality of life. Today, we're going to talk about the number one leading cause of death in America. And it's not COVID-19 or infectious disease. It's heart disease. It has been and always will be heart disease. And I have with us today a close friend of mine, a brilliant physician from New Jersey, Dr. Derrick De Silva. Dr. De Silva is on the staff of the Department of Medicine at Raritan Bay Medical Center in New Jersey. He's also on the teaching faculty of the JFK Medical Center in Edison, New Jersey. He's been on the planning committee for Age Management Medicine Group and a past president of the American Nutraceutical Association. I first heard Dr. De Silva at the American Academy of Anti-Aging Medicine several years back and was so impressed on his discussion about heart disease and the cause of heart disease. I decided I was going to get to know him and learn everything he could teach me about the treatment of underlying heart disease. So, Dr. De Silva, thank you for joining us today.
It's a pleasure, sir. Thank you very much for the invitation.
Well, in our society today, with all that's going on with the COVID-19, it's got everybody's attention, which has taken our eye off the real ball. And the real ball is heart disease. And why don't you talk about your transition from being a doctor that was more conventional in your approach to underlying health issues and heart disease, and how you made a transition to more natural approaches on how to treat the underlying cause of the problem rather than treating the symptoms that cause the issues.
Dr. Hotze, that's something I started from the very beginning of my career. This is something that I've been doing for 35 years. I was born in Sri Lanka, and this is the way my grandmother treated us. If you had any kind of an ailment, anytime I had an exam or a test, my grandmother would go outside. She'd pick some gotu kola. Gotu kola is one of the most incredible brain nutrients. She would make something called a melung, which was she would chop it up, put a little bit of coconut oil, a little bit of garlic, a little bit of ginger, with some nice brown rice, and that was my breakfast in the morning. So this is something that I've always done and I've always thought needs to happen. There's no question that Western medicine has a role. We all know
right.
that. But there's also a role for finding the root cause, as you said, from Eastern medicine, which is what is really the focus. And I've always believed that we have to use the best of both worlds. And that's the transition that I've always gotten into.
Well, let's discuss heart disease and the underlying cause of heart disease. If we ask the average person on the street, of course, and even the average physician, what's causing heart disease? What is the main cause of heart disease? They'd all tell us cholesterol. But folks, cholesterol is not the cause of heart disease, and we're going to discuss with Dr. De Silva the underlying cause of heart disease and what role cholesterol may or may not play in that.
Well, 60% of people that have heart attacks have normal cholesterols, 60%. So cholesterol is not the villain. It's inflammation. The inflammatory response, if somebody has inflammation in their wrist, for example, or their fingers, it's not just your wrist and your fingers. If you've got inflammation in your wrist and your fingers, you've got inflammation in the rest of your body, your eyes, your brain, your heart, and specifically the blood vessels. And that's where the damage and the disease begins, is if you've got inflammation within the vasculature, within the arteries, the veins, the capillaries, that's where the damage to the inside of the blood vessel, which is called the endothelial glycocalyx, which is a slippery gel-like layer, that's where disease and that's where inflammation and the problems begin. So treat the underlying cause, which is inflammation, not cholesterol. It was a great sales job that was done about 50, 60 years ago. It was a great sales job. And they're still doing it. Well, no, you can't. If you can't use it for cholesterol, well, maybe we can use it for something else. And that's what they're looking for.
Right. Well, so if inflammation is the underlying cause of heart disease, the arteries become inflamed, the glycocalyx, which is the superficial part that covers the endothelial cells that line the artery. If that breaks down and becomes inflamed, and the endothelial tissue and the cells become inflamed, and clots are formed, and that occurs. What has caused the underlying inflammation?
Well, the underlying inflammation could be, for example, diabetes. Diabetes is an incredible inflammatory condition.
It's the high sugar levels.
The high sugar levels. There are various infections. There are certain viruses, cytomegalovirus, the herpes virus, perhaps some of the other viruses that are around today.
Right.
They all cause inflammation.
Well, we know that the COVID-19 virus, the spike protein on the COVID virus, causes inflammation in the arteries. In fact, it's what causes the clotting.
Well, it causes the inflammation. So what happens is, and let me just back up and describe what this glycocalyx is. So if you take a fish out of water, the fish is very slippery.
Right.
Correct? You leave that fish out of water for, let's say, 5 minutes. What happens? You lose the slipperiness of the fish, which is that layer or that glycocalyx layer, and now you can just grab it and it's not slippery anymore. Within the blood vessels, that layer is called the glycocalyx. It's a layer that has it's a very, very complicated layer. And it's a layer that is literally alive. That layer has so much physiologic function, it's hard to even believe what this layer does. When you lose that layer, you expose what is called the endothelium, which is a single cell-like layer. If you think of shingles on a roof, the shingles are overlaid on top of each other on the roof. There's a little bit of an overlay. When you lose the glycocalyx layer, what happens is when blood flows, the shingles lift. Clots start to form on the lifted shingles. And that's the genesis of how the disease begins. So we have to do everything that we can to protect this slippery gel-like layer so that these clots and things don't form.
Well, so important to that would be to address the underlying cause of the inflammation. Like, as you mentioned, in diabetes, you have elevated sugar levels. And, of course, anybody that eats a high carbohydrate diet that would contain wheat products, potatoes, rice, corn, all those simple carbs are made up of sugar molecules. That's a starch. It's sugar molecules hooked together. So what happens is when you eat that, it dissolves in your mouth. The enzymes break it down in your mouth and in your gut, and all of a sudden you have high sugar levels. That can cause inflammation. So we find people that are overweight, whether they have adult onset diabetes or not, they tend to run high blood sugar because they're eating high carbohydrate diets, and that's causing the inflammation. So, folks, one thing you could do is change your eating habits.
Absolutely.
And what would you recommend as far? Now, that's one of the first things that can cause it. We'll talk about the other things that cause the inflammation. What can they do dietarily? What can they do to change their eating patterns? What would you recommend as far as eating healthy to improve or decrease the inflammation that occurs from high sugar?
All of the data that is out there is suggesting that the Mediterranean diet is the number one diet for this.
Which is
a combination of proteins, nuts, berries, fruit, etc.
And vegetables.
Of course. I am not a fan of any kind of an extreme diet. It needs to be a balanced diet. For people to say, well, I'm only going to eat eggs and bacon for the next 3 months. No, that's ridiculous. That's not the way we are made anthropologically to eat. We need to eat a variety. So you can eat, for example, complex carbs. What are they? Beans, peas, chickpeas, lentils. All of these are complex carbohydrates that don't break down into sugar. Or if they do break down into the sugar, it's not a spike of the sugar, it's a slow, gradual release is what we want. Because we don't want these spikes, because the insulin that is produced during these spikes is what produces the insulin is what is called a lipogenic substance. Every time you spike insulin, you build fat. So you have to control that spike.
And that's important, too. It's the insulin. It's not just the sugar, but the sugar causes the hormone insulin to be produced by the pancreas, and when that occurs, that causes inflammation.
Right. And that's one thing that I always check in my practice are insulin levels. For people who come in and say, I can't lose weight, I am doing everything. My weight is not coming down. What's your insulin level? Because if your insulin level is elevated, you will never lose weight.
Right.
It's just not going to happen.
Okay, another thing that causes the inflammation in the arteries is various infections, and this can be anything, bacterial or viral infections. So, and they found in the clots, I know, and in the atheromas they find in the coronary arteries, they find bacterial or viral particles in there. They've done that before, right?
Absolutely. Absolutely. They've specifically things like chlamydia. Chlamydia is one of those viruses. It's one of those bacteria that will do that. The herpes simplex virus. There's all kinds of bacteria and viruses that do this.
Another thing that there's some physicians and dentists that are very big on the fact that your teeth and your gums, if they're not healthy, they will produce viruses and bacteria, gram-negative bacteria too, that produces toxins that cause the inflammation in the arteries. So you've got to keep your teeth healthy.
Right. One of the things, Dr. Hotze, that I tell my patients, and I've done shows on this also, when you go to get your teeth cleaned, it's important. It's absolutely important that you get the plaque removed,
right,
et cetera. But the day before you go to get your teeth cleaned, you need to take something like a higher dose of vitamin C or a higher dose of glutathione or a higher dose of integrative paniculata. These are all herbs that will kill viruses and bacteria. Because when you clean the teeth, you bleed. Not only do you bleed, that you end up spitting out or when you rinse your mouth, but you're also bleeding into your circulatory system. So that's how you can, those organisms that are around your teeth are also going to pass through your heart. So this is something I always do the day before, the day of, and the day after. And this is something that I've not heard anybody else talk about, is cleaning, doing something like a high dose vitamin C, 4,000, 5,000, 6,000 milligrams of vitamin C, and some kind of an antibacterial. Again, I like Endographis paniculata. Endographis is an herb that is an adaptogen, that is a very potent antiviral, antibacterial, and actually also an antifungal. I do it the day before, the day of, and the day after.
So that's very important. And, this brings up this whole concept of teeth. Farmers understand this, folks. And there's an expression around it that says, don't look a gift horse in the mouth. And what do you think that means? Well, if somebody comes to give you a horse, why would you look at their teeth? Don't look a gift horse in the teeth. Well, when you go to buy a horse, you look at a horse's teeth to see if he's healthy or not. You look at a cow's teeth and you see if they're healthy or not. And a farmer knows that if they've got bad teeth, you don't want to buy them because they're not going to be a healthy animal. So when you get a gift horse, it's kind of an insult to somebody. Say, well, let me check his teeth before I take the gift. Before I take the gift. So, but that goes to, and now farmers understand this very well. I know that because recently we bought two horses, and one thing that my foreman does, he wanted to, when we went to look at the horses before we bought them at an auction, he looked at their teeth. Just make sure their teeth were healthy.
Interesting.
So farmers understand that, but we don't. What you've told us here, I've never had a dentist tell me, be sure before you come in to take something that's antibacterial, antiviral, whether it's vitamin C, whether it's the herbs that you recommended, or even an antibiotic. Occasionally, if they do surgery, they'll say if they're going to take out a tooth, they'll tell you to take an antibiotic.
Well, that's why. If you've had, God forbid, you've had a valve replacement or something like that, why is it that you have to take an antibiotic? Because the blood is going to circulate through the entire heart, and it's going to go through the valves.
It's going to carry the bacteria, and they
They get stuck on the valve.
They get stuck on the valve, and then you get a big problem.
Then you have a big problem. Yeah.
So anyway, keep your teeth clean, folks. Make sure you have good dental care, and be sure you take something before, the day of, and the day after.
When you do your teeth clean. Absolutely.
That's right. Now, the third thing that can cause inflammation is metallic substances like mercury, aluminum. We cook in aluminum. The dentists for decades have been putting mercury amalgams in your teeth. And we cook with aluminum. There's cadmium. There can be lead in the water. All these things, I understand, are highly inflammatory on the coronary arteries.
Not only on the coronary arteries, but also in one of the most overlooked organ systems within the body, and that's the liver. And I'm telling you, Dr. Hotze, I have seen this across the board over the past 35 years. One of the things that I've really noticed is people that have nervous system disorders, if you go back and ask them, what kind of work did you do? Most of them are going to say, and you have to really investigate this, plumbers, they've been around toxins, they've been breathing heavy metals. Those heavy metals go into the body and they get stuck in the liver. The hepatocyte or the liver cell cannot clean this toxin. So what happens? You end up having damage and disease that affects not only the heart, but more importantly, the nervous system and the brain.
Right.
Alzheimer's disease, all the neurodegenerative diseases of the brain are going to be affected.
I wonder if that may be an underlying cause of Parkinsonism.
Oh, absolutely. Mm-hmm. You just hit the nail on the head. After 9/11, what happened was that I've had 3 patients in my practice. Now, they're currently in my practice, all with Parkinson's disease. And they were a couple of firemen, and the other gentleman was one of the recovery workers there. All had Parkinson's disease. They have no other risk factors. It was the toxins from the environment in the air. No question Parkinson's disease is part of the neurodegenerative diseases.
Most of the diseases we have, folks, come from the toxins that we get in our body that are coming from the environment, in our foods, in the air we breathe. And it's hard to stay away from that, so we want to be able to detoxify ourselves. And what kind of detoxification program do you recommend on people? Do you use any chelation, any type of chelation? Tell us about that.
One of the best things that you can do to chelate heavy metals are B vitamins.
Okay.
So if you have access to somebody that can do, IV nutrients, you can get a nice high dose of some B vitamins.
Talking about a Myers cocktail.
And then a little bit more, right? So the B vitamins, and even orally, you can chelate some of those heavy metals. That's number one. The number two, the other good chelator, and one of the best things you can do also besides the B vitamins to clean the liver is glutathione. So glutathione is a good liver cleanser. N-acetylcysteine is another good chelator.
Which converts to glutathione. It's a precursor.
Right. But also something like saunas, infrared saunas. I have an infrared sauna in my home. I get in that infrared sauna 3 times a week. Mm-hmm. And it is after I get out of there, first of all, I feel like I've worked out for an hour because I'm drenching wet after 30 minutes. I get it up to about 135 degrees, and it is phenomenal to clean out your system. So what I really like are things like milk thistle, schisandra, glutathione, there's alpha lipoic acid and alpha linoleic acid. So yes, if you're using alpha lipoic acid, that's another great liver cleanser. Mm-hmm. And in fact, it's used one of the things I use to treat people with hepatitis C and then the other thing is turmeric, curcumin. Mm-hmm. Curcumin is not only an antiviral, but it will also help clean and cleanse out the liver.
So these are very important points to make, and we're going to put this list on the podcast so you can and have this available for you so you can know how to go through a good detoxification program. So we've got 3 things that we've talked about that cause the underlying inflammation, and that is the infections, diseases, and many of which come from your mouth and your teeth having poor dental hygiene. Secondly, would be high sugar levels, which lead to high insulin, and that causes the inflammation. and also the mercury and other metals that we get in our system. Those are three main sources of inflammation. Is there any other source of inflammation?
Well, things like high blood pressure is an inflammatory condition. Any of those, again, people overlook stress, the idea of stress. And one other thing that I want to mention to you very quickly before we go, people that have problems, and this is something I heard 20 years ago. I did a tour of the U.S. with 10 cities in 10 days. There was a dentist that I was with. Root canals, one of the worst things you can do, because every tooth is connected to a meridian within the body. People that have had problems with, for example, back pain, various ailments within the body, all related and connected to the teeth. So be very careful where you do a root canal.
Right. As a matter of fact, Dr. Huggins, who's a dentist, was real big on warning against these root canals, and I've heard many lectures on it. And I let somebody do a root canal on me, and then I realized I shouldn't have done it after I heard a lecture. I had that tooth pulled.
There you go.
Because you have some micro cavities up there in networks that even though you remove the infection in the root canal, you still got it in the tooth, and that seeds these bacteria into the body, which attack arteries and attack your heart. Yeah. Well, we've been visiting with Dr. De Silva today about heart disease. When we come back, we're going to talk about some very important natural treatments that you can use to treat underlying heart disease if you have it already. How can you cure it? How can you return your heart to a normal state? So thanks for joining us. We'll be back right after this message.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Welcome back. We're visiting with Dr. Derrick De Silva out of New Jersey. Dr. De Silva is one of the leading experts in the field of anti-aging, or you like to call it age management medicine. So he believes, like I do, as we mature in age, you want to be alive, alert, you want to be full of vitality and enthusiastic about life. You shouldn't be sick and tired of being sick and tired. And I know many people, even some of you listening to this program, are sick and tired of being sick and tired. There's no reason to feel that way. I'm right now, currently, I was born in 1950, so you can figure out how old I am. And I feel like $1 million. And Dr. De Silva looks like $1 million, but he's 20 years younger than I am. So
no, I'm not that much younger than you. I was actually born in 1957. So
there you go.
Just got my Medicare card.
Good grief.
I thought it was my dad's. I said, why are you giving me this card? This says Derrick De Silva. And my wife pointed out to me that it said Junior. So it was mine.
Well, in the first portion of our program, we visited with Dr. De Silva about heart disease. You know, most Americans right now, or at least over the last several years, have been fixated on viral infections, particularly the COVID virus, as a leading cause of death among Americans. And it's not, and it never was. The survival rate for people that get the so-called COVID infection, which doesn't even exist anymore. Now there are variants to the COVID infection. The COVID-19 is long gone. Now there are variants that have come out, and which tend to be, so far, they've been much milder than the infection. But those people that contracted that infection and were diagnosed with it and treated had a 99.99% survival rate. Now, in America, the leading cause of death is not viral illnesses or respiratory illnesses, much less COVID-19. The number one cause of death is and has been heart disease. And we discussed this on the first portion of our program, the underlying causes. We discussed inflammation as a major cause of underlying heart disease rather than cholesterol. Cholesterol is used by the body as a Band-Aid to cover the inflammation. Think about taking a piece of sandpaper and rubbing it on the back of your hand until it bleeds. That's inflammation. That's what the inside of your artery looks like when it gets inflamed. And your body doesn't like that. So what does your body do? It eventually clots off the bleeding and forms a scab, and then the cells grow scar tissue, and eventually the scab comes off and it's healed. Well, in the heart, when you get the inflammation of your arteries, that breaks down the glycocalyx, which is the inner lining of your arteries, and it's a very thin film over the endothelium, which are the cells of the inner lining of the artery. And when the inflammation comes, it breaks down the glycocalyx and breaks down the endothelium, and it's raw. And your body doesn't like that. It's going to deteriorate. And think about it. Every time your heart beats, it pulls that artery. Think about if you can see the vein on the back of my hand, if that was a left anterior descending artery, every time the heart beats, it stretches and compresses that vein. Well, that's what happens in the heart. It compresses and stretches the arteries, and if they're inflamed, they would deteriorate. Well, God's built into the body a healing mechanism, and it takes lipid and protein. It's called lipoprotein, which is protein with cholesterol, and it starts to Band-Aid on top of the inner lining of the artery. And then it assimilates calcium in there to harden the artery so it doesn't deteriorate and break down, which initially makes good sense. But over time, if you don't stop the inflammation, next thing you know, your artery is hard as a rock, and I've seen that, and you have too. And then you throw a clot down there, and it clots off, and you got a heart attack, and then you have problems. So what we want to do is stop the underlying inflammation. We said there were really three major causes of it. One is infections. Primarily those infections that come from they can come from other parts of your body, but the teeth are a big problem. Infection in the gums, infection in the teeth, root canals, all these will spread bacterial products and viruses into the bloodstream and seed into the arteries of your heart and other arteries of the body. But the heart's under the biggest stress, and that's where it causes inflammation. So you have infection. Secondly, you have high levels of insulin caused by a high carbohydrate diet. When you get a lot of sugar in your diet, wheat, corn, and potatoes and rice all convert to sugar, raises the insulin level, you get inflammation. And then the third thing is when we're exposed to heavy metals. And those metals would be like mercury amalgams. They'd be aluminum when you cook with aluminum. You may get lead in the water. You're breathing this if you're in an industry. For instance, you mentioned the plumbing industry where you're soldering with lead and those sort of things. You're inhaling that. And that will cause a tremendous amount of toxic damage to not only your coronary arteries, but as you discussed earlier, to your liver. And that causes a host of problems. We talked about how to detoxify that. But
one of the other things I want to mention too, excuse me for interrupting you, that people forget. There are so many environmental toxins. The average woman puts 128 different chemicals on her skin every day. The average man puts over 75 toxic chemicals on his skin every day. You say, well, men don't use cosmetics and makeup. Well, you do. You use shampoo, use conditioner, you use soap, you may use hairspray, you may use gel, you may use a body lotion. These also are called endocrine disruptors.
Right.
So the skin, which is the largest organ system of the body, is also something that we must become aware of. Look at the ingredients on your skincare. And Dr. Hotze, this is something recent for me. Within the past 2 years, I've started to look at how these chemicals become what are called endocrine disruptors. Yes. They go into the system, and the body looks at this and say, oh, this looks just like estrogen. Well, let me displace the estrogen that's there and let me bind to it. Well, that's an endocrine disruptor. Why are younger girls developing breast tissue earlier?
Right.
Why are they starting menstrual cycles earlier? Why are young men having testicular cancer at such an earlier age? Why are they having gynecomastia, the enlargement of the breast tissue. These are all endocrine disruptors, not only from the environment, but from the toxins that we're putting on our skin. So excuse me for interrupting you.
So really, and that's the fourth cause of this inflammation in the system is the petrochemicals that are in the environment. So
Absolutely.
And I neglected to mention that, and I should have mentioned that, and I'm glad you brought that up because that is a huge, huge problem. We know this in males over the last 50 years, their sperm counts are down to about half of what they were 50 years ago, and testosterone levels are low.
The ground. 30-year-olds are coming in to see me because they have no libido, they have erectile problems, and I do their testosterone
and it's
levels.
In the gutter.
They're 200. I said, you're 30. How can this be? My testosterone levels are 4 times that. I mean, what's going on here? It's the endocrine disruption, which is provoking inflammation. Remember one thing, folks, and I'm going to say this very carefully. The blood vessels down below are the same size as the blood vessels here on the heart. So I will never treat erectile dysfunction without doing a stress test because those blood vessels are the same size. And if you've got inflammation down below, you're going to have inflammation here. So be very careful when you go to your doctor and say, I want testosterone. Make sure you know what the underlying root cause is.
That's very, very important. I remember I saw a young man who was in the insecticide business, came in to see me when he was 28 years old, and he had no energy. He couldn't think clearly. He felt terrible. He wasn't overweight particularly. He just felt terrible all the time. Aches, pains. He said, I'm at 28. I feel like I'm 58. Which, by the way, I'd love to feel 58 again.
I was going to say, hey, be careful what you're saying here, Dr. Hotze.
But anyway, he didn't know that. Anyway, he said, I feel like I'm an old man now. And so anyway, we checked his testosterone level. It was just in the gutter. I mean, it was in the flat gutter, and we got him on testosterone. It was like we made a new man. Yeah. He just woke up because testosterone, folks, this is for you men. Most everybody thinks, well, testosterone is just for sexual function and libido. That's wrong. It's for initiative. It's brain function, initiative, assertiveness, sense of well-being, self-confidence, moods, goal orientation, your drive, your directiveness, your decisiveness, your analytical ability. All these are brain functions, and the hormones, both male and female sex hormones, affect your brain and the neurochemistry in your brain. Testosterone also affects your muscle tone, muscle mass, cardiovascular function, and your romantic moods and inclinations and abilities. But that's just part of it. It's very, very important for cardiovascular function and for your musculature. I go to the club and I play golf, and I see guys in the locker room. Guys, some are younger than me now. Most are, but there are some older guys. But I've noticed for years, all the older guys, they're pale, they're pasty, and they look washed out. Why? They don't have any. They're not ready. They don't look healthy. And they're not because their testosterone levels are low. Absolutely. And testosterone enables your bone marrow to produce red blood cells. And so what you find in older men is that their blood counts tend to get lower. They may not be anemic, so to speak, according to the lab values, but they're always down in the very low range. And that's why they look pale and pasty and their muscles are drooping. They're low in testosterone. This, as Dr. De Silva has mentioned, can occurs in people now that we're exposing ourselves to these endocrine, which is hormones, glands, endocrine disruptors that disrupt the hormones in our body so they don't function. We depress. When you get all these petrochemicals, they're xenoestrogens. They act like estrogenic products, and they get into males' bodies, and they turn down or turn off the production of testosterone.
Absolutely, absolutely.
And it feminizes males.
Absolutely.
And that may be one of the reasons we see all this craziness going on about, boys thinking they're girls or something like that.
You know something? That's a great point. Because what's happening here is they're starting to aromatize at a very young age. They're converting their testosterone to estrogen. So they're converting their testosterone to estradiol. And this, you just hit something. I just didn't even think of this. You just really hit something on that. But there are other things that we can do. There are things like, arterisol.
Let's talk about that. It's going back to the glycocalyx. So yes. If we have the inflammation, we've been exposed to to the petrochemicals, or we've been exposed to viruses and bacteria, we've been exposed to metals, and we've got high sugar levels. We've got this inflammation. We want to heal it, right?
Right.
So one thing you have to do is you got to do everything you can to stop the exposure first.
Correct.
I mean, you want to do that, but you still got the underlying problem. What can we do to help heal that?
There's, I've been working on this now for, I would say, 15 years. There is a seaweed. There's a type of seaweed that has the same building block structure as the glycocalyx. So,
and remind us again what the glycocalyx is.
the glycocalyx is a slippery gel-like layer that is above the endothelial layer,
Right.
which is a single-celled layer in the inside of the blood vessels. This layer was not discovered, was only looked at maybe 30 years ago, 40 years ago.
You know what? You mentioned that, and I heard your lecture, I don't know, 3 years ago or so. First time I ever heard a lecture on glycocalyx, ever.
Yeah.
I never heard of it before, and it's been around 30 years. How many other doctors like me never heard of it before?
Well, one of the cardiologists that I know very, very well, he came up to me and he heard me present this data, and he said to me, Derrick, do not ever give up on this, because this is the key to, you have hit on something that is the key to what's happening with heart disease. And I looked at him and I said, his name is Caesar. I said, Caesar, I'm not a cardiologist, but you know what? Cardiologists don't know this, and you need to teach them. And this is what I've been doing. It's become my mission,
Right.
because this particular seaweed has the same molecular structure as the inside of the blood vessel, which is the glycocalyx, that slippery gel-like layer. And the analogy that I have for this is, I have a driveway at home that's a very large driveway. That driveway has blocks in it. It's a block driveway. It's a driveway that has certain pieces of block that, if one of those blocks get cracked, what do I do? Well, what the guy said to me was, what I want you to do is, I'm going to give you a half a pallet of these blocks. So over the years, they're going to crack. Just take one out and put a new one in. And that's exactly what this does. That molecular structure that we have, that we get from this seaweed, replenishes, repletes, gives the body the ability to rebuild and to reheal. Because there's no other way to do it. Yes, you can reduce inflammation. Yes, you can get rid of infection. Yes, you can get rid of heavy metals. But if you don't have this, then it's going to be a problem. Where are you going to get it from? Because these blocks are made up of glycoproteins, peptidoglycans, different other complex sugars that rebuild the inside of the blood vessel.
Right. And when I first heard about this, I heard it at a lecture about 3 or 4 years ago at the American Academy of Anti-Aging Medicine, and it was Dr. De Silva was speaking about this, and I just sat there and I've always been interested in heart, always been an interest of mine, and I'd never heard of the glycocalyx before, and I thought to myself,
what is this guy talking about?
Well, I thought to myself, where have I been? I mean, why doesn't everybody know this? It's so obvious. Showed all the microscopic pictures of it and of everything that had happened, and he recommended the product called Arterisol, which is not even a prescription product. It's a product that doctors can give through their offices and through their practices, and there's no drug at all on the market that heals. Remember, folks, drugs are toxins. They have to be detoxified by the liver, and pharmaceutical companies cannot patent anything that's natural. That just can't do it. So the pharmaceutical companies don't promote anything natural. They're always going to promote drugs, pharmaceutical products, all of which are toxins. Nobody is sick because they have low levels of pharmaceutical drugs in their body. They're sick because they don't have, either they're toxic or they're not getting the right nutrients in their body to build the proper structures, from the endothelium to the glycocalyx to all the other organs of the body and the cells that are needed. And so tell us about this product, Arterisol. I was fascinated when I heard the lecture, and that there was some way that you could heal the glycocalyx.
Right, and that's exactly what I was just talking about, right? These are the building blocks. You've damaged the driveway. You have these particular blocks, building blocks within the driveway. You've damaged them. There's no way to replenish them is you got to go back to your basement, bring some of the blocks
Bricks
back up,
Right.
the bricks back up, and redo them. Now, there's another product that I really, really like, and it's called nattokinase. Nattokinase is what is called a fibrinolytic agent. So if you've got
Fibrinolytic, fibrin is like scar tissue, and lytic means breaks down. So fibrinolytic agent breaks down
the tissue. So breaks down the clot. So you've damaged your glycocalyx. Clots are starting to form. What are you going to do? Yes, you can rebuild the glycocalyx, but what about the clots? This is where something called nattokinase comes in. Nattokinase is from fermented soy. Not only do you have to ferment the soy, but you need to put a certain bacteria in there so that the natto is produced. I don't know if you've ever eaten natto. Have you ever had ferment? Don't. I was in Japan, and I was with a very, very, very important gentleman who was like an emperor. This guy was unbelievable. We were at dinner, and he gave this to me, and I said, I got to eat this. I got to eat this.
Because you're here and he offered it, right?
Dr. Hotze, I was so close to blowing my cookies that it was unbelievable. I don't know how I swallowed it. It tasted so bad, but they eat it there all the time, the fermented soy. So I wonder if it's between the seaweed that they eat in Japan, between the natto that they eat in Japan. No wonder their incidence of heart disease is so low. Not only are they rebuilding the glycocalyx, but they're getting rid of the little clots that are within the system. It's genius. I call it the dynamic duo. It's unbelievable. The two of them should be done together.
Right. So that's nattokinase, and because of Dr. De Silva recommendations on this over the last 3 years, we recommend this to our individuals. We do heart scans on all our new guests, and those individuals that have got problems with atherosclerosis, we know they have inflammation, so we recommend those products. And these products are over the counter too,
yes.
Which means they're going to be very inexpensive compared to cardiac drugs. Well, Dr. De Silva, this has been a great discussion with you. We've learned so much about heart disease, the underlying cause of heart disease being inflammation. And inflammation caused by high insulin levels from sugar, from bacterial infections, and from metal, and from petrochemicals. And we've learned how we can treat those by changing our eating patterns, staying away from those chemicals, and keeping our bodies healthy and our teeth healthy, and then taking something to repair. That would be arterisol and nattokinase. So thank you for joining us today.
My pleasure.
And thank each one of you for joining us.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.